Now, you wouldn't know about this if it wasn't for the good work of a South Australian politician, but children as young as 3 years old are being referred to gender clinics here in Australia. The Women's and Children's Hospital Gender Diversity Clinic in Adelaide has seen 3 kids aged between 3 and 5, 80 kids aged between 6 and 10 in the past 2 years. A total of 285 referrals to the clinic have been made for children in that time. I mean, children as young as 3. Joining me now is the man who unearthed these numbers, independent South Australian Upper House MP Frank Pangallo. Frank, you have previously pushed for an inquiry into gender dysmorphia and the medical responses to it in South Australia. That was hit on the head by the Malinauskas government. On the basis of these numbers, are you going to give it another go?
I am going to give it another go, and it isn't far from over, I can tell you that, Caleb. It wasn't brought to a vote, and it's still there for it to happen. But these figures that you've just outlined are quite disturbing, and I'll be, quite certain they're being replicated around the country, probably in greater numbers. The thing is, why are the authorities, why are state governments, why is the federal government avoiding a review of gender-affirming practices in Australia and also in South Australia? I can give you the answer for that, because they know that if they do, it'll find that these practices are actually being harmful to young kids.
And that's essentially what they've found overseas. I've written my column in The Advertiser about exactly this issue tomorrow. In the UK, they've banned, the NHS, the National Health Service, has banned the use of puberty blockers for children. But we continue here unabated, as though there's nothing wrong whatsoever. And when you hear these numbers, sorry, go on, Frank.
Well, I was just going to say, the crazy thing is, they're saying that the Cass review in the UK, now the Cass review was based on all the clinical data that was available to Hilary Cass. In other words, all the scientifically proven data that was out there. And she came to the conclusion that these practices were actually doing more harm to children than any benefits, and that there was no high-level standard of care for these children. Now we're getting the ridiculous situation here in Australia where the Federal Health Minister, Mark Butler, and also our State Minister in South Australia, and probably in other states as well, are saying that the Cass guidelines do not apply in Australia. It's crazy. In fact, the Cass review found that what is happening in Australia is causing harm to kids.
It is crazy, and you can go and have a look on the Women's and Children's Hospital Gender Diversity Clinic website, and it talks about all the things that they do there, and they say that they've got a mental health unit, but the mental health unit is basically focused on affirming the beliefs of these children that they want to change gender, and it includes, they give out chest binders for free, which are used by girls to suppress their breasts. It then talks about the fact that it prescribes puberty blockers, it prescribes hormone treatments. But when we're talking about, between the ages of 3 and 5, I mean, what 3-year-old, 4-year-old, 5-year-old needs to, and I acknowledge it's only 3 of them, but still, what 3, 4, 5-year-old needs to be sent off to a gender clinic, and what on earth would a gender clinic be doing with a 3, 4 or 5-year-old?
Well, exactly. We need to know why these kids are there, and I'll be asking more questions about that. But the other disturbing aspect is also the other ages, Caleb. Now, these children aren't mature enough to know whether or not they should be on puberty blockers and what damage it could cause them later in life. And we know that they do, and that they're irreversible. The other thing about these gender clinics in Australia is they don't also collect data on those that detransitioned, where it didn't work for them. We don't know how many are out there where they've had bad outcomes. Now, it shows you just what's going on in these clinics, and I think it's more ideologically driven. It's certainly not medically driven, because we've seen international reviews in some, in countries like the UK, in Europe, and also in the US, that show that these practices are harmful, and it's time to put the brakes on them. I cannot understand why Australia seems to think we are doing the right thing, even though you're following the same guidelines. It's just not acceptable, and we do need to have a look at it.
Yeah, and 80 of them between the ages of 6 and 10. And of course, when you first pushed for that inquiry, the Premier, Peter Malinauskas, said that he didn't want to get into the culture wars. Well, this isn't the culture wars. We're talking about real medical issues, serious, irreversible stuff being done to children. If that's not worth talking about, I don't know what is. Frank Pangallo, thank you so much for your time.
Well, I think...
Sorry, mate.
Thank you very much, Karen.
Sorry, mate, we've got to go.